Hello, I'm Joe Wren and welcome to this week's Indiana News Desk. Well, nationally, only 27,000 people have enrolled in the federal healthcare exchange. In Indiana, the number is 701. Those numbers the Department of Health and Human Services released this week are far below what the Obama administration had predicted. Here's a look at some other numbers in Indiana. Nearly 32,000 people have completed applications. Of those who have applied, more than 11,000 qualify for Medicaid or the Children's Health Insurance Plan. And another nearly 8,000 are eligible for federal subsidies. And that's a lot of numbers, so to help us understand the data, we now turn to Chris Schrader. Thanks for being here today. So what happens December 15th if not enough people sign up?
Very serious things. First of all, you will have a majority of people not having health insurance on January 1. That's the immediate implication. So the stated objective of the act will have not been met in substance. They extended the time that an individual have to enroll, select, and get into a plan, if you will, all the way till the end of March. So the upfront date is December 15. That's to have coverage on January 1. But there will be people enrolling over the course of the next few months. Really, the next date after December 15 is March 31. That's important.
Now, we said 701 Hoosiers have signed up, but have they actually paid? Because a lot of what we heard is that they're surprised at how much the plans cost.
Yes, they are. And no, we really don't know how many have paid. And my expectation would be that not many have yet. Because spending cash well in advance of when you have to isn't something that people normally do. But you bring up a very good point. There's a big distinction between, in an e-commerce lingo, a shopping cart having a product in it and then actually purchasing that and having it go through. We need to see those numbers going into December. I think if in November shopping carts are still full and you haven't seen a lot of payments being made, then there'll be real concern there.
Now, is there a point that the health exchange may just fail at some point, especially if there's not enough younger people signing up?
Yes, ultimately, whether the federal government is doing it or individual insurance companies are doing it, risk only works if your pool is constructed in such a way so that it can sustain itself. And the fear right now is that you won't have enough of the right mix of bodies in the exchange to make it work. And this is what the insurers are concerned about, because so far of the people who are actually enrolling, they are skewing older. So right now, the early mix is not good.
Now, Obama just announced this week that he's going to push back health insurance coverage for those who were going to lose it till 2014 or so.
Right.
Does that help Hoosiers?
It may or it may not. That's very murky at this point. First of all, again, I need to emphasize what the president has taken is discretion on enforcement. The underlying law remains the same. And this is going to be a critical factor with the 50 insurance commissioners. Each individual state has an insurance commissioner who is going to look at this and decide if they even want to allow it. Washington State has already said they won't. That was 2 hours after the president spoke, and Washington State commissioner said no. So if the commissioners don't approve it, it won't happen. Even if the commissioners say they'll go for it, if the insurance companies don't want to create products they can only sell for a handful of months, it won't happen. So I'm not optimistic this will have the intended impact.
Well, and people have until December 15th to select and pay for a coverage to be able to get it by January 1st.
To get it by January 1st. And so if you're an individual who's in a continuum of care and you want to have coverage, you need to act quickly.
Thank you very much.